Hi everyone, welcome to our Facebook Live this evening, and we're delighted to be joined by Paula Reilly. Hi Paula.
Hi Fiona, how are you?
Good, thanks. So Paula is a pharmacist. Paula, you used to work in Boots previously, and you just recently moved down to Longford, and along with your sister have opened a pharmacy in Longford.
That's right, yes. We've just opened, taken over Baxter's pharmacy in Longford.
Brilliant. And it sounds like things are going pretty well for you guys at the moment.
Yeah, can't complain now. New baby in the house as well, so it's all go.
Well, that's what I was just about to say. So you'd had the theory for this for years, of what pharmacist, from a pharmacist's point of view, but now you actually have the practical side of things as well with your own new baby, Owen, who you get to practice all your knowledge on and see if the theory holds true.
That's it, exactly, yeah. So he's almost 5 months old at now. So yeah, completely understand where parents are coming from.
So there's a few things that we thought we'd touch on. So this is all about parents with new babies and babies as they, maybe say up to the first year or so as they start to develop, and kind of the main illnesses or conditions or things that might happen as part of normal baby life, and just things for parents to look out for, some tips of how to deal with those things, and some advice that they can maybe store up for when they need it along the way.
Yeah, exactly. Yeah. So becoming a new parent, as everyone knows, is really exciting, but it can be very daunting as well. Because there's plenty of things that can crop up that can create moments of panic and stress, and you don't really know what to do, especially as a new parent. So I'm just going to touch on a few of the things that we commonly see people coming into the pharmacy about, but also what I've experienced as a new mum as well.
Brilliant. So the first one, and probably the most common one, is fever, I guess, and high temperature.
Yeah, so every parent at some stage is going to experience fever in their child. Obviously, no one wants to experience it, but it is something that's very common indeed. So, a high temperature or fever essentially is something 38 degrees or over. So, I suppose first and foremost to say is that every new parent should invest in a thermometer. There's a range that you can get, plenty of them in the pharmacies. One of the ones I recommend is this one here. It's the Braun Thermoscan. It's an ear thermometer, and it's a really important device that should be in every household that where there is any kind of babies or children at all. So if you identify a baby as having a fever or a high temperature, there's plenty that you can do. So we're all familiar with our Calpol or our Nurophens. These are both suitable for over 3 months of age, and they are great at bringing down temperature. I suppose the key thing to point out is in babies that are very young, under 3 months, these aren't licensed for under 3 months. The Calpol is post-vaccination over 2 months, but the others aren't. It's really important that you are checking their temperature, and if you're anyway concerned that you're seeking medical advice straight away. If you know yourself, if your child is out of sorts, they're not their normal self, maybe they're not feeding as normal, maybe they're crying more than they would normally, or they're just not smiling as much and they're not themselves, then do seek medical advice. Or if you've given one of these products and they don't seem to have worked for you and the temperature is remaining high, then absolutely you need to go and get that checked out. And just to mention, there is an alternative as well, which is suppository form. So if you have a child perhaps who may be vomiting and can't keep like the likes of your Calpol or Nurofen down, there are suppositories that you can get in the pharmacy also. Your pharmacist will be able to advise you on which one is most appropriate.
Perfect. Okay, brilliant. And then if we move on to maybe another common in a condition, I guess you call it among children, colic. Maybe we'd start off and go through what exactly is colic and how parents know if that's something that's causing the problem.
Yeah, so colic it's very distressing for any parent to have a baby who suffers from colic. It is unfortunately it is very common. 1 in 5 babies can suffer from colic. We know all babies will cry at some stage, but colic is different. So colic is where there's excessive crying. So essentially it means if they're crying for more than 3 hours a day, more than 3 days a week, for more than 3 weeks. And that essentially is what colic is. As I said, extremely distressing. You want to do anything you can to try and stop the crying and help them and ease them, and you don't want to see them in pain at all. But there's some products that you can get in the pharmacy that can help. One of the ones here that I have is Infocol, so that can help. Again, it might be the wind that will help with this, that is causing that, I suppose, excessive crying. Another product is Colic, infant colic drops as well, and they can help. There's a couple of other products too. It's worth trying these. Your pharmacist will be able to advise you which one to use first. Some of them you administer straight to the mouth, some of them you put in the baby's bottle, depending if you're breast or bottle feeding. But really, aside from that, there's some practical tips as well, like baby massage can help. Obviously you'll be rocking your baby and trying to soothe them anyway, but gently massaging their tummy may help as well, and a few practical tips like that. But again, it can be very distressing.
So Paula, there's no one definite cause for colic. There's just a number of things that may be causing it, and you kind of have to try out a few different of the solutions, say that you mentioned, and see if one works, and if not, move on to something else.
Yeah, unfortunately, like probably a poorly misunderstood condition, and that no one really knows exactly what causes colic. The good thing to say is that it is self-limiting, so like a child will grow out of it, and typically they'll grow out of it by maybe about 4 months, and maybe a little bit longer. But it will generally appear in the first few weeks, maybe a little bit later, but should subside. And it, as I said, it will go, it will pass. It's very difficult at the time, but it will pass. But yeah, it's not understood exactly what does cause it. It may be thought to be excessive wind, perhaps. So using techniques, there's certain bottles that you can get as well, that will help reduce the amount of wind that the or air that the baby is consuming that causes that excessive wind. So they're worth trying as well.
And is that something again that if a parent isn't sure, is this colic or is it something more, they could go to their pharmacist as a first point of call and get some advice and figure things out from there?
Yeah, absolutely. Because more than likely, if you go to your doctor, they're going to recommend trying some of these techniques firsthand anyway. And we're seeing people coming in with colic all the time, so we would be familiar if there's something we think that it's something else other than colic. Generally we will be able to identify some of those warning symptoms, and we'll be able to refer a parent to the GP if necessary.
Brilliant. And I should have said actually, right at the beginning, that if anybody who's watching either live or watching us back later, if you have any questions, pop them up. I can see the comments as they come in, and I'll let Paula know, or if they come back later, one of us will see it and we'll make sure to get back to you. So if you do have any questions, send them our way. Paula, I'm speaking on Paula's behalf, but she'd be delighted to answer them and pass on all her advice and knowledge. So Paula, the next thing that we're going to talk about, and this is just unpleasant even to think about, but constipation for the
Yeah,
glamour side of things.
yeah, it is another one, that your baby may experience. Again, it's horrible seeing, any baby in distress with constipation. So every baby, first of all, is different, is what I'll say. Whether you're bottle feeding or whether you're breastfeeding, your pattern of how often your baby passes stools will be very different. If
Okay.
something out of the ordinary, where maybe they're not passing stools as often, their bowel movements, they're less frequent, or maybe they're harder in consistency, then yeah, perhaps your baby does have constipation. What the treatment will be will very much depend on the age of the child. So obviously, if you've weaned your baby and they're on solids, then introducing some pureed prunes, increasing some of their water consumption, dietary advice can help. Avoiding things like bananas, they can be quite constipating, as can carrots. So certain foods can help there. But obviously, if it's in a younger baby and they're not consuming solids, then there's little you can do. There is a product, a stool softener, that you can get in the pharmacy. So speak to your pharmacist. It's from 1 month onwards, so that can perhaps help. But again, your pharmacist will be able to give you all the advice that you need. But it'll just depend on what age the child is.
And when you were saying about if the baby was weaned and you were able to they were in the pruning state, or sorry, you could give them food to help with the situation. You mentioned prunes, just to chew them down, was it included in whatever food they're eating, or give them to as it is?
Oh yeah, like you could puree it, blend it down, and mix it with another, perhaps with blueberries, or maybe with avocado, with another vegetable, whatever you want. Yeah, just to add it into some of the solids that you're giving, that will help get things moving.
Brilliant. Okay, that's mad about carrots. I would have never thought that.
Yeah, some foods, yeah, I wouldn't be aware of.
Yeah, yeah. Okay, brilliant. And then the last main thing that we were going to touch on was teething, which obviously everybody knows that it's a horrible thing for anybody to go through, never mind a little baby. So any advice or tips for what to do when your baby is red in the face and you can just see the pain that they're in?
Which was my little baby all afternoon. He is
Oh,
So yeah, typically babies start teething around 6 months, but some will start a little bit earlier. It can start from 4 months and maybe a little bit later. It doesn't matter when they start. Every baby is different. But again, it's horrible seeing them again in distress and in pain. But the good thing is there is plenty of things out there that you can get to help kind of ease that pain as such. How will you know if they're teething? As you said, their cheeks will be quite red. They'll be eating their hands a lot. They might be trying to, bite at everything that they can get, and they're out of sorts. They're quite distressed, and they're just not their usual happy self. There's various different things that you can get. This one here is a homeopathic option. They're Tida granules and Tida gel, quite effective. You just apply the gel to the gum area, likewise just put in the granules into the mouth, and they can help ease it. There's other gels that you can get. Everyone's familiar with the Bonjela. There's a Bonjela teething gel that you can get. But there's also other things like teething rings and stuff that you can pop into the fridge. make sure they're not too cold, but that will help ease the pain as well. And obviously, if they're in a lot of distress, you can give the likes of Calpol, Nurofen, if necessary. But again, it is horrible to see any baby teething and in pain. If they're a little bit older, then they can use, you can use finger foods that can help, like apples and things like that in their hand that they can bite into, can help ease the pain as well.
Okay. And Paula, you mentioned Nurofen there, and we were talking about it earlier at the very beginning with fever. What's the difference, say, between Nurofen, paracetamol, ibuprofen, the Panadol, the common ones that you see in pharmacists?
Yeah, so they're both two painkillers. So they both act as in reducing pain. They also both act in bringing down temperature. So antipyretics is what that's called, and where it brings down any fever or temperature. The Nurofen contains ibuprofen, as you mentioned, which is also an anti-inflammatory agent, which are important in older children if you need to bring down inflammation. But technically, they both do the same job in terms of bringing down temperature and in relieving pain in babies. The only thing is that Nurofen may not be suitable for every baby. Perhaps if a child suffers from asthma, it may not be suitable. Now, it's not to say it's not suitable, but it just may not. They may have a reaction to it. Calpol generally would be safe for most people.
Okay, brilliant. Well, Paula, that's been really, really helpful. Is there anything else that you think would be good to pass on, or has that covered the main things that you thought were important for people to know?
Yeah, look, this time of year we're seeing a lot of babies and kids coming in with colds and flus as well. I suppose the key thing to say is a lot of them are viruses, so antibiotics aren't always necessary. And there is again plenty you can get to kind of ease those symptoms. Just to be aware, like there's saline drops and there's snuffle babe and all these kind of things that can really help. And we can even see them coming in from the doctors on prescriptions where they're trying not to give antibiotics and they're trying to give agents like these to help symptoms.
Okay.
But there's a lot of viruses going around at the moment. Hand, foot and mouth is another one that we're seeing quite a lot of in the pharmacy. So yeah, there's loads. But as I said, speak to your pharmacist. We see it every single day and there's loads of advice that we can give. And do seek help. None of us are able to do it all. So plenty of support out there.
And if you're near Longford, pop into Paula in Baxter Healthcare. She look after you there. Yeah, Paula, that's been brilliant. Thank you so much. Thanks for all the advice. And as I said, if anybody has any comments or questions for afterwards, leave them there. One of us will see them and we'll get back to you as soon as we can. Thanks so much, everybody, for watching. And thanks a million, Paula, for joining us.
Great. Thanks, Fiona.
Thanks.
Thanks. Bye.